Welcome to Health 24 by 7.
Hello viewers, I am Dr. Rahul Reddy, consultant andrologist from Andrology Institute, Hyderabad. So today we are going to talk about erectile dysfunction. So there are so many doubts when it comes to erectile dysfunction, whether this is treatable, whether it's a long-term problem, whether it's a short-term problem. I'll try to answer all your queries. Okay. So what happens is, whenever a male is having erectile dysfunction, first thing is we have to diagnose. So just taking a medication, just taking a pill may not help these patients, because that becomes a temporary issue. So now temporary treatment. Now see, whenever there is erectile dysfunction, first thing is there are four major causes. One is psychological. In this category, we'll have unmarried people, or people who tried earlier and there is a failure. They fall under this psychological area. Second type is hormonal area. See, whenever there is hormonal imbalance or vitamin deficiency in the body, like testosterone deficiency, prolactin imbalance, testosterone to estrogen imbalance, estrogen excess or testosterone on the lower side, or thyroid issues, vitamin D deficiency, vitamin B12 deficiency, all these things comes under hormonal imbalance. Third type is vascular AD. So vascular AD means, see, penis is like a balloon. There are two cylinders inside the penis. If these two cylinders are properly filled with blood, you get a proper erection. Any disturbance in this blood flow can cause erectile dysfunction. Again, if you see why this comes, then it can be because of smoking, alcohol, diabetes, hypertension, high cholesterol. For some people it can be genetic. For some people it's their lifestyle. So now this is similar to your heart related problems. See, blood vessel damage anywhere in the body is blood vessel damage. So now fourth type of erectile dysfunction is neurogenic erectile dysfunction. See, the moment I say neurogenic, it doesn't mean that now related injuries. So one, it can be problem in the nervous system, or it can be problem in the spine. Third one is even prostatitis. That means infections in the prostate, seminal vesicle. They can affect the nerve which comes to the penis, and so it can lead to erectile dysfunction. So now, whenever patient is having erectile dysfunction, first thing is we have to classify into these four different categories. Sometimes it can be combination problem also. Sometimes it can be hormonal and vascular, psychological and vascular, or psychological and hormonal. So now, if it is combination, then we have to address both the issues. Unless we identify the root cause and start treatment from root cause, treatment of erectile dysfunction is not permanent. If you start just treatment without diagnosing properly, then it becomes a temporary approach. So what happens sometimes, you may see improvement with medications. The moment you stop medications, again you will go back to same state. Unless you find out the root cause, then you can't treat it completely. Okay viewers, then today we discuss different types of erectile dysfunction. Now in coming videos, we will talk about each type of erectile dysfunction separately. Okay viewers, bye. If you have any comments or questions, ask in the comment section. We will try to answer all the questions, and otherwise give us some suggestions so that we can make videos pertaining to your problem. Thank you viewers.
Subscribe. Click on the bell. Like, comment, share.